Assalamualaikum. My name is Muhammad Farhan. I am from SRELC590-3 and I will be giving an informative speech talking about understanding dissociative identity disorder or DID. Good morning or good evening or good afternoon to the lecturer. Today I want to shed light on a complex mental health condition known as dissociative identity disorder or DID, often misunderstood and stigmatized. DID is a profound condition that significantly impacts those who live with it. By the end of this speech, I hope you have a clearer understanding of what DID is, its causes, symptoms, and the treatment options available. Let's begin with what dissociative identity disorder actually is. DID is characterized by the presence of two or more distinct personality stages or identities within a single individual. These identities may have their own names, ages, history, and characteristics. It's important to note that DID was previously referred to as a multiple personality disorder, but this term is less commonly used today as it oversimplifies the complexity of the condition. Now let's discuss the causes of DID. The primary causes is severe trauma during early childhood, often resulting from extreme and repetitive physical, sexual, or emotional abuse. The disorder is thought to be a coping mechanism. The mind dissociates to protect the individual from overwhelming pain and distress. Other contributing factors can include prolonged stress, a lack of supportive relationships, and genetic predispositions. However, it's crucial to understand that not everyone who experiences trauma will develop DID. So let's moving on to the symptoms of DID. Individuals may experience significant identity disturbance. This includes gaps in memory regarding everyday events, personal information, or traumatic experiences. Many people with DID feel like they have multiple identities that take control at different times. Additionally, they may experience dissociation, which can manifest as feeling detached from one's thought, body, or sense of identity. It's not uncommon for them to feel like they are observing themselves from outside their bodies or feel disconnected from reality. Mood changes are also common, as individuals may exhibit shifts in behavior and attitudes that differ markedly from one identity to another. Diagnosis of DID can be complex. It typically involves a thorough clinical assessment by a mental health professional who may use standardized interviews and questionnaires to evaluate symptoms. Regarding treatment options, psychotherapy or talk therapy is the primary approach for treating DID. Various methods such as cognitive behavioral therapy, or we can call it CBT, and dialectical behavior therapy, or you can call it DBT, focus on integrating the separate identities into one primary identity. While there are no specific medications for DID, individuals may receive treatment for co-occurring conditions such as depression or anxiety. Support groups and peer support can also provide valuable resources and understanding for those living with DID. In conclusion, dissociative identity disorder is a serious and complex mental health condition rooted in trauma. Understanding DID is crucial to reducing stigma and fostering compassion for those affected. By raising awareness and promoting education, we can create a more supportive environment for individuals living with DID. Remember, mental health matters, and it is essential to approach this topic with empathy and understanding. Thank you for your attention.